topic is autoimmune diseases. So here we are going to see about what is autoimmune diseases, causes of autoimmune diseases, their symptoms and treatment for those diseases. So first we are going to see about what is autoimmune diseases. So autoimmune diseases are conditions in which our immune system mistakenly damages our healthy cells which are present in our body. So usually our immune system protects us from diseases and infections, right? So the diseases and infections are caused by some bacteria, viruses, pathogens, or commonly called antigens. So if any antigen enters into our body, our immune system produces antibody and destroys the antigen. So here, if a person has autoimmune disease, their immune system cannot find a difference between the antigen and the healthy cells which is present in their body. So it mistakenly destroys the healthy cells. Okay. So if a person has autoimmune disease, the immune system cannot find a difference between antigen and healthy cells, and it produces a protein called autoantibodies. This autoantibodies destroys the healthy cells and causes diseases. So types of autoimmune diseases include rheumatoid arthritis, Crohn's disease, and some thyroid conditions. Next, causes of autoimmune diseases. First, sex. So females between the age of 15 to 44 are more likely to develop autoimmune diseases than males. Next, family history. Family history means due to inherited genes from our family members or ancestors, we are more likely to develop autoimmune disease. Then environmental factors like exposure to sunlight, chemicals like solvents, and some other environmental factors. And especially coronavirus also cause autoimmune diseases. Then ethnicity. Ethnicity means some certain autoimmune disease is caused to some certain group of people. For example, white people from Europe and the United States are more likely to develop autoimmune muscle disease. And lupus autoimmune disease is occurred in people who are living in Africa and America. So some certain autoimmune diseases is caused to some certain group of people. This is called ethnicity. Next, nutrition. Our diet and nutrients also causes severe autoimmune disease. Next, other health conditions like obesity. Obesity causes autoimmune diseases. Next, most common autoimmune diseases. So now we are going to see about some most common autoimmune diseases which attack us. First, type 1 diabetes. Type 1 diabetes means pancreas produces hormone called insulin, which regulates our blood sugar level, right? So this, if a person have autoimmune diseases, their immune system destroys insulin producing cells in our pancreas. So it causes high blood sugar level. If the insulin producing cells are destroyed by our immune system, it causes high blood sugar level and it damages our organs and it causes damage to our blood vessels and organs. Next, rheumatoid arthritis. In rheumatoid arthritis, our immune system attacks the joint. While rheumatoid arthritis is more likely to develop the people in age of 40s, 50s. If they get older, rheumatoid arthritis is developed. But if a person has autoimmune disease, it started as early as your 30s. Next, psoriasis. Psoriasis means skin cells. Our skin cells grow and then shed when they are no longer needed. But if a person has psoriasis, their skin cells are multiplied too rapidly and produce more cells. This extra cells build up and causes inflamed patches in our body. So psoriasis means skin cells grow and they are not shed. They multiply rapidly and they are fixed in that particular area and causes inflamed patches. Next one is multiple sclerosis. Multiple sclerosis damages the protective coating surrounding nerve cells, which is present in our central nervous system. So this damage to the myelin sheath slows the transmission of messages between our brain and the spinal cord, and between our brain and spinal cord and from the rest of our body. Okay, so this is called multiple sclerosis. Then Graves' disease. Graves' disease means Graves' disease attacks the thyroid gland in our neck and produce too much of thyroid hormone. Too much of thyroid hormone attacks our body. So this hyperproduction of thyroid hormone causes disease to our body. So thyroid hormone controls the energy usage known as metabolism. Next, autoimmune vasculitis. So autoimmune vasculitis happens when your immune system attacks blood vessels. So whenever our immune system mistakenly attaches to blood vessels, autoimmune vasculitis happens. Then Hashimoto's thyroiditis. In Hashimoto's thyroiditis, thyroid hormone production becomes slow. So here the thyroid hormone production becomes slow and it causes deficiency. Next, inflammatory bowel disease. So IBD describes conditions that inflammation in the lining of the intestinal wall. So IBD means inflammation in the intestinal wall. Some inflammation in the intestinal wall. This condition is called as inflammatory bowel disease. So it is of two types: Crohn's disease and ulcerative colitis. So Crohn's disease means the inflammation is from GI tract. GI tract means gastrointestinal tract, from our mouth to our anus. So this region, from mouth to our anus, here this region, if the inflammation is caused from our mouth to our anus, this disease is called a Crohn's disease, and the inflammation is caused from the large intestine to our rectum. This inflammation is called as ulcerative colitis. Okay, from our mouth to our anus. The inflammation is caused, it is called Crohn's disease, and from large intestine to rectum, the inflammation is called ulcerative colitis. So IBD is of two types. So normally IBD means inflammation in the lining of the intestinal wall. Next, common symptoms of autoimmune disease. So some changing of lifestyle is the most common treatment for autoimmune disease. So now we are going to see about symptoms. So symptoms like fatigue, dizziness, low grade fever, muscle aches, swelling, trouble concentrating, numbness and tingling in your hands and feet, hair loss, skin rash. Skin rash means it is caused by psoriasis. So these are all the common symptoms which is caused by autoimmune disease. So there are various symptoms. So some particular autoimmune diseases have their unique symptoms, but these are all the common symptoms. Next, treatment for autoimmune disease, medications, sleep medications, anti-inflammatory drugs, then painkillers, insulin shots for type 1 diabetes, plasma exchanges, creams and pills for rashes, for psoriasis, lifestyle changes. So these are the treatments for autoimmune diseases. So there is no cure for autoimmune diseases, but at least we can treat our autoimmune diseases and manage the symptoms, and we can lead a normal life. So getting diagnosed and starting treatment as soon as possible can help prevent more severe damage. So there is no cure for autoimmune disease, but by the treatment we can manage the symptoms. Okay. Thank you.